So, you've probably seen an X-ray of a painful joint, and you might have heard the word arthritis. But saying that is kind of like a detective showing up to a crime scene and just saying, well, a crime was committed. It doesn't really solve the case, does it? So today, we're going to put on our detective hats and figure out exactly what's happening inside that joint using nothing but an X-ray as our guide.
Okay, take a look at this. It's pretty obvious this is arthritis. But here's where the real mystery begins. Arthritis isn't just one thing. It's a huge umbrella term for over 100 different conditions. So, is this just from years of wear and tear? Or is the body's own immune system actually attacking itself? Getting this right, well, it's absolutely critical.
And that's because, you can't treat the suspect until you've identified them. The treatment for one type of arthritis might be completely useless or even harmful for another. So the radiologist's job is to find those specific, tiny clues in the image that point to the right diagnosis, which then leads to the right treatment for the patient.
So how do they do it? How does a radiologist crack the case? Well, it's not guesswork, that's for sure. They have a system, a toolkit really, of specific evidence they're trained to look for. And it's this systematic approach that turns what looks like just a confusing black and white image into a clear set of clues.
And here it is. This is the detective's secret weapon, the ABCDS mnemonic. It sounds a little technical, but it's really just a simple, incredibly powerful checklist. Let's run through it real quick. A is for articularity and alignment, basically how the joint surfaces line up. B is for bone, checking its density and looking for any weird new growths. C is for cartilage, which on an X-ray is really that space you see between the bones. D is for distribution, where in the body is this happening? E is for any extra findings, anything else that looks out of place. And finally, S is for the surrounding soft tissue. Okay, let's put this toolkit into action.
All right, let's open our first case file. The prime suspect, osteoarthritis. You've probably heard of this one. It's the classic wear and tear arthritis. We're going to apply our ABCDES toolkit and see what kind of unique fingerprint it leaves behind on an X-ray.
Look at how the clues start to build a really strong case here. For B, bone, we see the body is actually building new bone where it shouldn't be, creating those things called bone spurs. Then for C, cartilage, you see the space between the bones is closing up, but it's lopsided, it's asymmetric, which makes total sense for mechanical wear. And for S, soft tissue, you might see things like Heberden's nodes, those classic bony bumps on the fingers. See? It's all pointing in one very specific direction.
So the verdict is in. All the evidence points to a degenerative process. Osteoarthritis isn't about the body attacking itself. It's all about mechanical stress leading to cartilage breaking down, and then the body making this sort of misguided attempt to repair the damage by building extra bone. Case closed.
But wait, let's bring in our second suspect, rheumatoid arthritis. Now this is a completely different culprit. This is where the body's own immune system mistakenly attacks the joints. Let's pull its file and see how its profile compares.
And whoa, right away we see a completely different pattern. Under A, for articular, we find erosions. The immune system is literally eating away at the bone. Then for B, bone, instead of building, the body is losing bone density because of all the inflammation. And look at C, cartilage. The loss is symmetric, it's uniform, because that inflammation is attacking the entire joint all at once. Let's put these two suspects in a lineup, side by side. I mean, it is crystal clear. Osteoarthritis is degenerative, and it builds bone. Rheumatoid arthritis is inflammatory, and it destroys it. One has that lopsided, asymmetric joint loss, the other has even symmetric loss. These distinct signatures are what allow a radiologist to tell them apart with confidence.
And what's really cool is this ABCDS toolkit is so powerful it can identify even more culprits, each with its own unique and sometimes kind of bizarre-looking fingerprint on an X-ray. Let's look at a couple of other suspects with some really memorable clues.
This might be one of the most descriptive terms in all of medicine, the pencil-in-cup deformity. On an X-ray, it looks exactly like it sounds. The end of one bone gets eroded into a sharp point, just like a pencil, while the connecting bone gets worn down into a little cup shape. It is an unforgettable image.
And that pencil-in-cup deformity, that's a classic fingerprint pointing directly to psoriatic arthritis. It's this fascinating mix of both bone being eaten away and new bone being created, which is a real hallmark of this condition. And as the name suggests, it's often linked to the skin condition psoriasis.
Okay, now for another highly specific clue. Radiologists call these punched out or even rat bite erosions. And honestly, it's like something literally took a bite out of the bone, leaving this sharp, overhanging edge.
And notice how they're located just a little bit away from the joint surface itself. This very specific type of damage is the calling card of gout. What's happening is that uric acid crystals are building up and triggering this intense inflammatory reaction that just eats away at the bone. So once again, a very specific visual pattern points the detective right to the correct diagnosis.
So, after running through the whole checklist, identifying these unique patterns of evidence for each and every suspect, the radiologist can finally deliver their verdict with a really high degree of confidence.
Ultimately, solving the case of arthritis isn't about finding one single gotcha clue. It's about the discipline of using a system, just like that ABCDS mnemonic, to meticulously gather all the evidence and see the overall pattern. That pattern is what truly tells the story of the disease.
And you know, this method of systematic pattern recognition isn't unique to radiology. From interpreting an EKG to diagnosing a skin condition, so much of medicine relies on this same detective-like approach. It kind of leaves you wondering, doesn't it? What other complex problems in our lives could be solved, not with a single flash of insight, but by applying